another episode of Elevate. My name is Mansi Gandhi, your host for today. And here we have a very special guest, Jordyn. Welcome to Elevate, Jordyn. How are you today?
Thank you, Mansi. I'm wonderful today. Thank you. How are you?
I'm well too. Thank you so much for asking. It's a pleasure to have you, and we would love to hear more about yourself. Do you mind introducing yourself?
Absolutely. So my name is Jordyn Samuels. I use she/her pronouns, and I'm more known as an EDIA consultant, facilitator, trainer. EDIA stands for Equity, Diversity, Inclusion, Accessibility. Doing a lot of EDIA related trainings for the past 19 years. Anything related to anti oppression, anti racism, anti black racism, to us LGBTQIP plus education. That's usually within this context, I'll say queer and trans. That stands for two spirit, lesbian, gay, bi, trans, intersex, asexual, pansexual, queer, and all other sexual and gendered diverse identities that weren't represented within the acronym. So with that mouthful, I'm just gonna say like queer and trans, throughout the podcast. And yeah, so I've been doing these kinds of trainings to try to move service providers in the right direction in terms of how to provide culturally competent services to clients and also how to support your own staff who are from marginalized backgrounds. So I offer in-depth trainings on anti-oppression, anti-racism, microaggressions, unconscious bias. I work with organizations to do equity, diversity, inclusion assessments. And this is all within my main consulting company that I've opened in 2016. That's called Journeys in Equity Consulting. But overall, I've been doing this work since 2006. That started pretty much in high school, essentially, and it's been a consistent road since then. My EDIA journey started in high school because I was outed within like the first month of grade 9. I did go to a Catholic all girls school, and it definitely wasn't a great experience going to Catholic school, especially in the era that I was attending. You weren't allowed to be openly gay. So essentially, there was somebody who confided in me that she was also part of the queer and trans community, and I entrusted her and came out to her and I said, "Well, I'm lesbian." She told me that she was bisexual, and then I came out to her and told her that I'm lesbian, and unfortunately, she used that as bait to tell the whole school. So immediately I was outcasted. People were spreading rumors, spreading a lot of stereotypes that didn't apply to me, and just stereotypes that were, learned in the Christian community, in the Catholic community, and Catholic upbringing, of like negative stereotypes. So I joined an anti-bullying group at my high school, and they were learning about gender-based bullying and violence, and race and cultural-based bullying and violence. I asked the teacher who was overseeing the student committee, if we could also speak about too much LGBTQ plus related violence. And her response to me was, "You're not allowed to be gay in Catholic school." So that really tugged at my self-worth. In addition to me not having the best relationship with my mother at home after I was outed at home as well. My mother and I are on great terms now, but at that time it was constant from home to school, just torment about being part of the community, and especially with all the negative images about like you're not even supposed to exist. So I wanted to find out more information. I knew I couldn't get there from school, so I joined a research project from Planned Parenthood Toronto. This was when I was 16. This research project was trying to gain statistics about sexual health knowledge from like youth around Toronto. Like, where do you find your sexual health knowledge? This was from Planned Parenthood Toronto. Like, what more do you need to know about? And to be able to administer these trainings, we got anti-oppression and LGBTQ plus training to be able to speak more to the identities that were on the survey, and to answer any questions that anybody had about marginalized communities. So from when I first received that anti-oppression and queer and trans related training, and I was part of that project for the next few years, and then I just realized that I really loved doing facilitations and trainings around anti-oppression and teaching people about queer and trans people, ways how to be respectful, the reasons like why we should be treated with dignity, just basic respect. And, it was training service providers about the different language and the different meanings between different sexualities and genders, and trying to get people. So that just became a constant, a linear thing. We actually got trained with those trainings from Planned Parenthood at New College. New College was part of University of Toronto. The president of New College introduced herself and was the reason why I joined the equity program and sexual diversity studies program at University of Toronto. That's what those were my double majors at U of T. My major was equity studies and sexual diversity studies. I was also facilitating with supporting our youth, which was part of a program of Sherborne Health, where we would do anti-oppression and 2S LGBTQ plus trainings to service providers and teachers who were either in school about to be those professions or who were already in the field practicing about like how to improve cultural competence. And when that program started running out or dwindling down because of funding, that's when I opened my own company, Jordyn Equity Consulting, in 2016. I just also wanted to make a change on a more organizational level. I had been working with organizations one-on-one and improving their policies, practices, drafting action plans. But it's one thing to engage with an organization and then leave, but it's another thing to actually be part of an organization and make long-term systemic change from within. And that's when I joined CMHA Peel Dufferin as the EDIA Strategist in 2023. So everything from high school, because of what I experienced, just trying to make a commitment in letting people know who's out there and best ways and best practices on how to support different marginalized communities, especially, coming from a Black background and understanding my queerness from a cultural perspective, what that can also mean for people from other cultural perspectives as well, and just trying to be an advocate. And that's just been a long-term journey since my teenagehood. So today I'm joining you as the lead EDIA consultant of Jordyn Equity Consulting. That's my own consulting service. But I'm also more recognized especially around Peel Region, because my 9 to 5 is I'm the Equity, Diversity, Inclusion, Accessibility Strategist at CMHA Peel Dufferin. That's Canadian Mental Health Association Peel Dufferin. Folks might see me either in the EDIA role within CMHA or also as a trainer role from Jordyn Equity Consulting. But today I'll be joining you from Jordyn Equity Consulting as a consultant, speaking about my overall experience.
It's been a long journey, I must say, but a very, very giving back to the community sort of a journey. I'm sure you would be proud of yourself.
Thank you.
It just makes me curious that do you face challenges where the kind of practices that you see, how do you state that these are fit for certain environments? Would you like to tell us more about that?
Absolutely. If I speak about EDIA in general, there's always room for equity, diversity, inclusion, and or accessibility. It should always be and, but there could be organizations that need to, highlight accessibility as well. So there's always so much room to grow. Depending on the professional environment, equity, diversity, inclusion, accessibility is going to look different. So if there's an organization that, serves Black communities, for example, it's also good to be able to have services that speak to intersectional Black communities, like having services for Black, queer, and trans people, Black disabled people, Black neurodivergent people who are receiving culturally specific services can also receive culturally specific services in across many different demographics, not just the standard identities essentially. And the more sites people face marginalization are often the more supports people are going to need within society and within services. So through my training, I do a lot of emphasis on intersectional identities, and also on just explaining explaining why we do practice around pronouns. When we're speaking to people who might be gender diverse or trans, just having that basic back to grammar conversation, because a lot of times people, if they're being misgendered or people if they're experiencing a toxic environment where they're not being recognized or affirmed, then that pushes them away from services. In terms of staff, that pushes them out of their jobs and then just creates job instability and gaps in resumes, which isn't conducive a lot of times for like rigid hiring practices.
Right.
So it's going to look different. EDIA is going to look different when we're talking about underrepresentation. If there's a large population boom, how does a school support services in different languages across different access needs? People who speak ASL or various languages. A lot of EDIA is transferable, but it's going to look different in organization. In an office space, EDIA might look like training around cultural competency to reduce or to at least highlight the presence of microaggressions, like what that means, the impact that might have on staff, or even the impact that microaggressions might have on clients in a specific industry.
Absolutely.
Or EDIA highlights the statistics of why certain demographics are underrepresented within a specific professional environment or within a field. There's so much room to grow. Many communities that still need to be supported, and the work is continuing, which is promising. So my role is really just to see where there's gaps, see how these gaps are exacerbated by historical colonial legacies that impact disproportionate rates of lack of access to health, lack of access to housing or education or finances within different professional demographics, whether that's people who are being underrepresented within hiring practices or people who are underrepresented as clients within an organization that's supposed to be serving specific demographics. So during lockdown, and as people started coming back to work gradually or just even participating in society, there was a discourse about everybody should be masking to be able to reduce community spread of COVID and of any other airborne virus. And that was seen as the standard and what you should do. And if you get exposed and if you get sick, you should be home for this amount of days. That wasn't convenient for a lot of providers because their entire workforces have been like off for a lot of periods of time. So suddenly the quarantine time becomes less and less and less. Suddenly the standard practices disappear and we return back to normal, and now there's so many more viruses that exist. And there's a huge masking community, or sometimes called COVID conscious communities. One of their biggest fears is just being stigmatized about wearing a mask, even when they go to job interviews, because sometimes the different cultures at the organizations say, maybe you shouldn't mask because it might scare the customers, or it might give the wrong idea, or it might make people think that you are sick. And even if you are sick, we did learn that even if we are sick, then we should wear a mask to reduce spread, in addition to filtering whatever is already existing in the air. Destigmatizing people who want to mask, because the same people who were vulnerable during lockdown are the same people who are vulnerable today. People can be immune compromised, people could be on medications that suppress their immune systems, people could just live with immune compromised people, and just because the danger still exists and the attitudes socially might have changed doesn't mean that there's been a push to go back to normal. It doesn't mean that the danger and the impact no longer impact the most vulnerable people anymore.
Yeah.
The impact still continues. The people who have the worst outcomes are immune compromised and disabled people. Yeah, so there needs just to be a destigmatization, masking as being like suspicious or criminal, because people are just trying to stay alive, literally, and shouldn't have to be stigmatized for that, or shouldn't have to be forced to put themselves at risk to make somebody else comfortable. That just goes way back into self-determination and like having control over your own body and being able to protect yourself, even if the environment is not set up to protect everybody.
That's where the inclusivity part comes into picture, right? If I'm getting this correctly.
Yeah, EDIA looks different across different organizations and different areas, but I'm here to help them focus.
This might sound as a silly question, but when I had done my DEI training, at that time it was called DEI.
Yes.
Is it something that's introduced recently? And I've heard you saying EDIA instead of DEI. Is there some difference, or does it make a difference?
I don't think it makes a difference. More letters are necessarily, I think in general, more letters are good because it speaks to more, not necessarily identities, but more avenues. I say EDIA just because that's my most common role.
Okay.
Like, I'm an EDI consultant for my own company, and then I'm an EDIA strategist at CMHA Peel Dufferin.
Okay.
The most common acronym is DEI.
Right.
And I would say that accessibility is the newer addition, but it's not the newer problem. Ableism is the problem. Disability or disabled communities and disability justice communities have been fighting against ableism and have been fighting for, overall access needs for decades, yes. Generations, at least decades. And so that's why, even though accessibility, like, it should already exist within equity, diversity, and inclusion, but we have just been finding that that hasn't been the case. So it's important to name accessibility, to always highlight that ableism and accessibility cannot be excused or separated from the overall work towards EDIA.
So when you say that A had to be added into the DEIA, what would be the impact of leaving the acronym A when we talk about DEIA?
Thank you for asking that. The impact is definitely that disabled communities get left behind in so many different ways. And we have seen a lot of different ways that accessibility measures have been normalized or provided within society and then just snapped back when it's no longer convenient or defunded. So it works just like the 2S LGBTQIAP plus acronym, because there's just not one monolith. There's not one way to be. The more that we name different identities, or the more that we name different letters within an acronym, it gives us different avenues to be able to make systemic changes. Right. So, for example, at the beginning of lockdown, suddenly it was possible for a lot of the workforce to work, remotely from home. That specifically has been an access need that a lot of disabled communities have been fighting for to be normalized for decades. Right. And not even just for everybody, but just for the people who need it the most. It doesn't have to be everybody. There's people who prefer to be in the office. But there are people who might experience chronic pain, or people who might do their best thinking at home, or people who realize that they experience less microaggressions when they're at home. Not none, because you can still experience them virtually. But even if you do experience microaggressions at home, then you at least are in your space to be able to decompress in a different way than at work. And then all of a sudden, that's scaled back. Or people used to have access to virtual doctor's appointments, and that used to be funded on a provincial level. And then that stopped, and now people have less access. Or just to normalize the fact that not everybody, especially marginalized communities, even have access to family doctor to be able to validate, different support needs or different accommodations to an organization. And that just creates a huge discrepancy. So if you organize a culture of access, which can normalize the fact that disability happens, and, there's people who are disabled who also get left behind when funding gets pulled, action plans are not fully as inclusive as they can be, and when there also is a discourse in society that it's okay to leave high risk and, disabled elderly people behind. That kind of discourse just normalizes the fact that certain communities are disposable. And that can come out in policies and practices and even just attitudes. So just being able to highlight accessibility and highlight different ways that EDIA can be expanded to be more inclusive is a plus, especially with everything. If you don't name a specific community, or if you don't name a specific road, then more people get left out of the conversation.
And then when we talk about the LGBTQIAP plus communities, what does gender affirmation looks like for them?
It can be answered by both a service and a policy perspective. So from a service perspective, gender affirming care and gender affirming support can be anything that supports a validating work experience or a validating service experience. On the flip side, if that person is not receiving a validating experience, it can quickly turn into a toxic environment, a toxic work environment, or a toxic service provider environment as a client. So just being able to have gender affirming services to affirm who somebody is and to validate who somebody is, doing things like having low barrier name changes. It's usually not an issue if somebody changes their name, if somebody, like when somebody gets married. From maybe non-work perspective, like, changing all that tax stuff, that's going to be difficult. But when you are, changing your name as a client or changing your name as an employee, disproportionately trans and gender diverse people are forced to provide documentation about why this is important. Or sometimes there's organizations that won't allow somebody to change their name unless they've reached a specific level of transition, which is already arbitrary because you don't have to transition physically to be a trans person. Yeah. You can transition socially, like you can wear different clothes, you can cut or you can grow out your hair, you can change your pronouns. There's so many different ways you can transition socially, but there's additional barriers that exist from organizations that make it harder for trans people. Barriers that don't exist for people who are not trans. And the same thing goes for when it comes to service, having name changes or even having preferred named options on intake forms, and actually using those names consistently through like all social interactions, and especially in waiting rooms. Even sometimes organizations do request preferred names, but then in the waiting room, the person is dead named. And the word dead named essentially means that they're referred to as a name that they no longer associate with, usually the name that they were assigned at birth. A trans or gender diverse person was assigned at birth. That contributes to a public dead naming, which can out a trans person. It can increase anxiety for trans and gender diverse people within waiting rooms. Just being able to have low barrier options for name changes or for preferred names. There's also different options where maybe as a standard practice for all patients or for all clients, you can just use last names. Or even if there's a trans or gender diverse child where the parents might not be accepting, you can at least just use the child's last name. That wouldn't be, set off warning bells to the parents. And that's still a way to affirm a gender diverse child in a way that is fair to everybody, essentially. Okay. Also, asking pronouns on intake forms and using those consistently, being able to have an expansive list of pronouns, more than just she and her and he and him. But then also coming back to the drawing board and having more conversations with education around just, we really have to bring this back to basic grammar, because I think folks often, forget that we use pronouns on a regular basis. And the conversation around pronouns sometimes tumbles into, well, we should just not use pronouns at all. But then this is why we need to bring it back to basic grammar, because we have to remember that pronouns are just a basic part of an everyday sentence. Yeah. I've used many pronouns within the last few sentences. Yes. I, we, our, your, It really also comes back to understanding the why. So when people get trained about why this is important, why it's important to validate people and who they are, why it's important to practice pronouns that we might not be familiar with. When people understand the why, it helps them do the what. So it helps them do the practices like, learning more pronouns, how to use them phonetically, practicing what we do when we misgender someone, practicing differentiating sexuality from gender, practicing not making snapshot judgments about people and their gender identity and presentation. So just those are different ways of supporting. And then also when it comes to a service perspective, gender affirming care can also look like the creation of 2S LGBTQ plus specific services within an organization or within a school. So that can look like a gay straight alliance or GSA or a rainbow group within a school, or it can look like an employee resource group within an organization where queer and trans staff can get together and speak about emerging trends, speak about different policies and practices that might be missing from the organization and where they might want their organization to be in terms of expanding best practices for queer and trans communities, or even if there's a service that's missing that disproportionately impacts trans people, then having working groups or having ERGs that are dedicated to expanding access around those services or those gaps to be able to support trans communities.
Right. Because
Well, in terms of what we can do on a policy level to support 2S LGBTQ plus, gender affirming care and practices, we can do things like having reoccurring education to build upon, the hour or 2 hour training that somebody might have received, months ago or a year ago, to build cultural competence and to understand again different nuances between the different demographics and different identities and even the different gaps that different communities experience and how we can reverse those. It's important for everyone to understand the what so that they can do the how. It's good for organizations to have clear guidelines around what is considered heterosexist behavior or what is cis-sexist behavior. And this is behavior that just reinforces being cisgender as the norm or being heterosexual or straight as the norm. And that this can come out in different policies, practices. It can come out in microaggressions that flip by that nobody, exists. It can be just a scapegoating that politicians are attacking a certain community, and then that becomes a discourse. So within society, so organizations can also create clear guidelines, around what is considered, like queer harassment or trans-specific harassment, and have different accountability measures when interactions happen that might not be at the best standard of service providers supporting their clients or also of staff interacting with each other. Sometimes we can also have heterosexist and cis-sexist interactions on a regular basis. And then also creating gender neutral or all gender washrooms. Having those kind of spaces in addition to gendered washrooms. Nobody's saying to get rid of gendered washrooms altogether, but especially if an organization has capacity to have a gender neutral or all gender washroom that's different from an accessibility washroom, they can both be single stall. The more capacity and more money an organization has, then the more people can, the more organizations can do with that.
Yeah.
But definitely having at least one gender neutral or all gender washroom space, because trans people exist in every single space, and we don't have to gender ourselves. Like, we all have gender neutral washrooms in our homes. It really doesn't take too much to have a single designated stall in addition to gendered washrooms as well, so that everybody has a chance to go to the washroom.
No, fair. It might. I'm not saying it might sound like a small thing or a big thing, but it is also a thing which needs to be taken into consideration, because there are organizations who probably, or there are places who people don't really think about that why it is important to even have a all gender washroom.
Right.
So I'm glad you brought that point up, because it's so important to bring it out to people that yes, even this is an important aspect that you should be considering when we talk about the EDIA lens of how we want to progress ourselves. It brings me to a question where we would love to understand, are there any emerging trends or policies in the DEIA which you think we could learn more about, or you would like to highlight specifically?
Yes, I'm glad you asked. Some of the promising trends that I've seen related to EDIA are things like expanding policies like flex days. Well, it's called flex days at my organization, but essentially days that are given that can be taken for religious holidays or for a doctor's appointment or for anything in addition to a sick day.
Right.
It might even be used as a mental health day. So or even just the emergence of mental health days. Sometimes the only way to receive support around mental health is if you get validated that you're going through mental health crisis. As we all know, in Ontario, it's expensive to get a therapist. Sometimes we're on wait lists for years and years, or sometimes we might only have access to a short-term therapist, maybe for 1 or 2 sessions, if or just might not receive services at all.
Right.
Sometimes people, might not speak about mental health in their community, in their cultural communities, as the word mental health, and because of that people just don't seek services because nothing is related to supporting their own mental health. So the emergence of mental health days and understanding that people can get overwhelmed for a number of different experiences, especially marginalized demographics who constantly might be experiencing certain like losses in their communities. There's a lot of violence that happens. There could be state violence that happens to racialized communities, Black communities, especially people going through mental health crises, disproportionately who are Black and Indigenous and people of color who lose their lives, from officers acting extra aggressive with racialized communities during mental health crises, or just being part of a community that's constantly having to fight for survival, being part of a queer or trans community and not being out to your family, not having supportive family or friends or coworkers. Or somebody might have lost a parent or a friend or a pet that was very close to them. Might need a day or two or even a week. But where can you get that justified if you don't have a family doctor, if you don't have a psychiatrist, or even if your family doctor or psychiatrist doesn't even think that you need that much time? So I love that we're talking about mental health more, and I love that mental health days are being expanded. Hopefully we can get more, and hopefully it can become a standard practice across all organizations, and also ongoing cultural competence and sensitivity training, so that staff can know more about why they're doing what they're doing.
Right.
I think it's great right now that a lot of health organizations in Ontario are receiving anti-Black racism training and Indigenous cultural sensitivity training to be able to provide more culturally sensitive services, to be able to provide services in ways that are affirming and in ways that are, less demeaning in terms of like practice and in terms of interruption of traditional practices and services. There's a higher push to be able to understand and reclaim different forms of cultural practices that might have been interrupted or that were interrupted, as a result of colonization, as a result of Western standard practices. And I really love that there's a push towards expanding cultural competency and the training behind that, so that staff understand why they're doing what they're doing, so that people can fill in the gaps in ways that are intentional and meaningful.
I see what you mean, because culturally, talking about mental health and mental health related problems was something was always seen as a taboo, at least in certain cultures that I am aware of. And then now, when people are getting more aware about it, and even having a therapist was something like a taboo. And then now, when people are feeling okay about it and they're kind of getting more knowledge about why it is important that these changes need to be made, I see that even organizations giving that a day off to people when they need it, keeping in mind that yes, you don't need a doctor's note every time. I would say it's commendable for organizations who are seeing the importance of it.
And also the training goes hand in hand with this, because as service providers, we also have a role in the impact that we have on other people, in the services that we provide, and the gaps that we might maintain.
Right.
The gaps, and I like to call them the colonial baton that has been passed on generationally, or that's been normalized throughout service provision and gets wrapped up in practice. So like the extra barriers, like it might take so much longer to update someone's name in a computer because XYZ, which relates to somebody commonly being dead named or misgendered, and then or not having the understanding of why gendering somebody correctly is important, because pushing them out of services is going to decrease their mental health and decrease their access to services. So also talking about the accountability of ourselves and our roles as service providers and how we interact with our friends, family, colleagues, clients, and the impact that we might have that might also exacerbate somebody else's, mental health challenges and barriers.
Right.
And that is why EDIA exists, because, we want to be able to provide services in a more equitable and inclusive way. And we need to understand why this is important and ways to do this.
Right. So then, if there is an organization who is willing to adapt these practices, is there any special advice that you would want to give them, or maybe any keywords that they should use?
It's funny that you say keywords, because the first thing I actually was going to say was we have to start with language. Understanding the best language to use for certain communities, the most culturally relevant, updated language for communities to be inclusive, welcoming, validating. Also, promotion of gender neutral language, because gender neutral language is language that is more inclusive to all or most. And this is not only specific to pronouns, but also, moving from, oh, is this mommy, is this your mom and dad, to, are these your parents, or are these your caregivers, or, is this your sibling, or, gender neutral language is specific to being able to adapt to more people as opposed to maybe stigmatizing some. So just having gender neutral language in the common practice and policies to be reflective of more communities and of more people. Also doing practices like maybe sending interview questions beforehand when it comes to hiring practices. People, are able to best prepare. Having different hiring practices, like offering people to send video responses in place of a resume, because sometimes people articulate themselves better than they're able to write about themselves. Yeah. Myself, as an example, I came from a completely different professional background. A lot of my consulting work was, part-time or on a case-by-case basis. So I didn't actually have, a documented full-time job until about a year or two ago, because even while I was doing consulting, I was also finishing school. And this also speaks to the discrepancies that happen with especially marginalized communities, racialized communities, cash poor, like communities that come from working class backgrounds, racialized backgrounds, queer and trans backgrounds. There are often a lot of things that happen in life that can create more instability. So, and gaps in resumes, and gaps in, taking time away from school, taking time away from work, for different reasons to be able to deal with life. Right. And then trying to get back into the workforce, being met with a lot of rigid hiring practices, or hiring practices that just that go by the book and might value more academic knowledge than actual community experience. Right. So being able to expand hiring practices that values a lot more community-based experience, maybe even without education at all, especially because especially as people are experiencing the backgrounds that people are learning about. And if people have already been doing the work, you might not need the education, like the formal education. Yeah. Expanding hiring practices, and also things like being able to accept verbal resumes as opposed to just written resumes, so that somebody can be able to speak more to their experience and articulate more about why their skills can be supportive to the role, as opposed to just a rigid standard of creating a resume and a cover letter. Also having a gender affirmation allowance, or also a specific gender affirming section within existing benefits. So within existing health benefits, a gender affirmation section, or if those don't exist within current benefits, then having a gender affirmation allowance, where if there is somebody who is transitioning, to be able to take time away, to be able to maybe even have a fund to be able to update their clothes, to update any kinds of day-to-day expenses that can affirm their gender, because they're already going through enough. Because often transgender diverse people are often going through enough barriers socially to even be accepted and to be validated, and being able to have support in being who you are, it can mean the world for somebody who is likely struggling, especially against the Ontario healthcare system. Also, organizations can do EDIA assessments or DEI assessments. And that is essentially, and a lot of organizations have, because they need to report to funders, but also having assessments even within specific communities. If it's not EDIA specific, maybe having a queer and trans specific, or a 2S LGBTQ plus specific assessments. Or even if it is general EDIA assessments, to be able to assess where an organization is and where they would like to go in terms of being able to have a certain number of programs, or to be able to increase a certain amount of clients, or increase a certain demographic of staff. So being able to do assessments of where an organization is, and being able to create strategies to expand equity, diversity, inclusion, accessibility in so many different realms, essentially.
Right.
And even just having a strategic plan for each letter, and a strategy around equity, a strategy around diversity, a strategy around inclusivity, and a strategy around accessibility.
Absolutely.
As well, because all of those, especially accessibility, is its own legal, category as well. So there's so much work to be done, and there's honestly so much room to grow.
Each letter definitely needs its own work. I see where you're coming from, especially when you say the aspect of having interviews being done, interview questions being sent beforehand. Like, I myself am a person who gets anxious very easily. When we talk about, oh, I have to be in front of 3 people, I don't know what they're going to be questioning. And then I'll sit down and read a plethora of stuff. And then at the end, maybe that all that information was not needed, but then the amount of stress that I took beforehand mentally exhausted me so much that I might have not given my 100% out there.
Exactly.
So it really caught my attention, because that itself is part of the impact that it causes on mental health. That really spoke to me immediately when we talk about adapting them and implementing them on an organization level.
Yes.
So thank you so much for bringing them forward.
Yeah, thank you for sharing that experience. Absolutely. It reminds me of the fact that a lot of disability justice communities share that when you implement practices that support the most marginalized people, especially, like, let's say disabled people and disabled communities, it also supports more than just disabled communities.
Right.
It ultimately creates what I like to call a culture of access, which I'll speak about in 1 second. But I think it's really important to say that because yes, there's people who can be stressed or experience anxiety because they might have clinical anxiety, or they might have, or they might be or they might be neurodivergent, and might not be able to speak on the spot as well as being able to be, like, well prepared.
Yeah.
Or you might not be, or somebody might not be any of these and just experience nervousness. But when those practices are there as a standard, then that can support more than just the people who disproportionately impacts.
Yes.
Disproportionately, people who disproportionately are excluded because of these reasons that happen over and over and over again. And which reminds me about the culture of access, and thinking about the different barriers that it might take to even get accommodations. I spoke before about the fact that not everybody has a family doctor to be able to validate whatever supports they need, or sometimes they might even have a family doctor, but they might be on a wait list for over a year for a specialist to validate something else.
Right.
Or somebody might not have a doctor at all, and even when somebody does provide, or even when somebody does want to submit an accommodation, that has to go through a process and an approval, and that approval sometimes might turn into a rejection or might turn into a modification. like best case scenario, it doesn't. Um, but also speaking to communities, especially who don't have doctors to be able to validate their support needs, just being able to have conversations and understanding that we all, whether people are disabled or not, whether people have disabilities or not, we all have different access and support needs that are going to change over time.
Yeah.
Um, and and moving away from a more clinical and rigid structure of accommodations to a culture of access and what that looks like. And this is what I learned in a training one time, a disability justice training. This looks more like having conversations with your staff on a regular basis about how they're feeling, how they're doing, and any kinds of support needs that might need to be adjusted or shifted at any time. There could be a student who might be having a more high stressful time because it's exam period and they're also working full time. And during that exam period, they might need to do a little bit less of something at work.
Right.
Or somebody might be experiencing high stress because of what they're going through in life. Or somebody, could be going through just literally anything. And they might need a certain support, or somebody even could be in chronic pain. Like somebody could be having chronic pain, and especially maybe during the winter time, where it could be harder for a lot of people with chronic pain in the wintertime because of colder weather. And during that time, it might be somebody might want to work from home a lot more than during warmer weather, for example. So just being able to have ongoing conversations about what somebody might need at one point or another, because it also is a lot of pressure to be able to come to your manager or supervisor and say, I need this. And be afraid of having to over-explain themselves about like why they need that, or trying to validate. It can be, depending on the person and depending sometimes on the practices, the standard practices, it can lead to more exclusion and at the very least procrastination.
Right.
Somebody might just not want to come forward because they feel stressed about what the response is going to be, or because they don't have all of the paperwork together.
True.
But if they're able to have common ongoing conversations about access needs and about just different supports that somebody might need more of at one point than another, then that creates a better culture of access, and that normalizes being able to talk about support and accommodation, or support and accessibility, in a way that can be less stigmatizing or less anxiety inducing.
That's so true. And now I think I see why and how important it is. Because yes, I have been introduced to this topic. Yes, there have been bits and pieces that have been part of trainings, but then the way how you've explained it, it actually gives a holistic picture of why and how, and now the relation between the why, the what, and the how,
how.
that kind of falls all into place, and it gives a much more better clarity.
Absolutely.
So thank you for doing what you're doing.
Thank you.
So that brings me to the last question of our chat today. If you get a chance to go back in time and get a chance to advise your 16-year-old self, or even tell us a joke or anything of that sort to your 16-year-old self, what would that be?
Okay. I wish I had a joke on hand. That would be great. But I'm glad I made you laugh, even if I didn't make
Well,
a joke. But,
appreciate that.
thank you. I guess that was my joke. But yeah, there's the best days, honestly, are yet to come. I could not have even imagined. I'm a little bit more than double 16.
Okay.
Maybe I'll leave that part out. But okay, I guess me in my 30s never would have been able to fathom how beautiful life can be if I just stay alive and keep pushing. Um, there was a lot of discourse from home, from my school, from my church, that instilled in me that I shouldn't exist, or just the way that I exist is immoral or just is wrong. And that honestly has a lot of it has a lot of negative implications on somebody who's young and impressionable and trying to find themselves,
Yes.
trying to validate themselves, uh, especially in a world that can also be politically validating those same negative sentiments.
True.
And if not politically, then at least socially, at least culturally, even in the language and the jokes that get passed around in society.
Right.
So, so just being able to understand that the best days are yet to come, and there's so much more to look forward to in life than just our hardest moments. Um, there's so many, for all the days that we experience darkness, we also experience light that we never could have imagined. The most beautiful surprises in life that you just never knew were existed or destined for your destiny. I love the surprises in life that I don't even know are going to happen in the next week or months or years, but I'm so excited for that to happen. And I'm just glad that I kept my drive to stay alive and my drive to make a positive impact from when I was 16, and that became a lifelong journey. And I'm so glad that I have committed to that journey and that I've been able to grow into, you know, I can't believe I'm still talking in my mid 30s about what I was talking about when I was 16.
I love that. The best days are yet to come. It also gives a sense of hope that, and hope is very powerful.
That's all we have sometimes.
Honestly, yes. It has been a pleasure to have you on Elevate, Jordyn. Thank you so much for joining us today. And we look forward to having more conversations in the future.
Thank you so much, Mancy. I really look forward to hearing this podcast back, and I really look forward to continuing these conversations as well.